Hello, everyone. My name is Dr. Chris Myers. I'm a licensed physical therapist and core faculty at South College Doctor of Physical Therapy program. In 2021, I completed the Doctor of Science degree at Bellin College, and as part of those requirements, completed the research study I will be highlighting in this presentation. Our research team also included Dr. Glenn Thompson, Dr. Lindsay Huey, Dr. Jody Young, Dr. Dan Roan, and Dr. Casey Rentmeester. And our study was titled An Exploration of Clinical Variables That Enhance Therapeutic Alliance in Patients Seeking Care for Musculoskeletal Pain, a Mixed Methods Approach. To start off, what is therapeutic alliance? A recent definition comes from Allo-Davy and colleagues in 21, and it speaks to the multifaceted nature of building alliance. It's an ongoing integrated relationship between the clinician and patient. It requires collaboration, trust, and respect to work together towards agreed upon goals. Evidence suggests that strong therapeutic alliance directly impacts functional outcomes for patients participating in physical therapy. We embarked on this research journey to study the factors that may positively or negatively influence the alliance relationship and thus impact our patients' lives and potentially our profession. We did this by creating an evidence-based therapeutic alliance variable checklist. There were three key takeaways from our research results. Number one, by using our alliance checklist, we identified these clinician behaviors as being most highly associated with strong therapeutic alliance scores. You can read through these, but just really appreciate how these might really link well with establishing that collaborative relationship. Number two, we also found that the lack of these three clinician behaviors was most highly associated with poor alliance scores. Body language, patient education, and then not summarizing what had been heard from the patient in the subjective interview. And number three, our final big takeaway, establishing strong therapeutic alliance can have a direct effect on decreasing a patient's pain perception following the initial evaluation. So we know increasing therapeutic alliance will improve outcomes, but how can we use that information now? For clinicians, try self-inquiry and reflection. Consider utilizing an alliance checklist to assess your therapeutic alliance process. Consider enhancing these skills of the heart and mind through post-professional training opportunities. Academically, consider, is there a benefit to teaching students alliance skills in entry-level DPT education? And if so, are there opportunities to enhance curriculum to maximize alliance skills? And from a research perspective, there are many areas for continued growth in the realm of alliance in physical therapy. Are there other factors associated with a strong therapeutic alliance? Behaviors or even other factors such as the clinic setting, telehealth versus on-site, front desk interaction, both live and over the phone. Another consideration, if we teach TA building and entry level, what skills should we focus on? Which behaviors can be enforced in the entry-level setting? Consider, is there a correlation between day one alliance scores and patient drop-off? So finally, in summary, therapeutic alliance has an impact on patient outcomes in physical therapy. And there are ways to positively impact alliance to improve those patient outcomes. But there is still much to learn. And finally, here is the full text direct link for our study. Thanks so much for listening.